open. The team's online buzzer will turn green once the team has successfully buzzed in. All the teams can buzz in when the buzzer system is open. Each time a team buzzes into the system, the buzzer controller automatically receives a timestamp to me, the buzzer controller, indicating the order in which the teams buzzed, whether it's the first fastest team, second fastest team, or the third fastest team. So the important point here is the amount of time assigned. So there is 7 seconds after each question has been completely read out, and the buzzer controller will indicate to the audience or moderator the first fastest team to have buzzed in. Example, team 1 or team 4, whoever it is that I see here. Once called upon, the team must provide the answer to the Jeopardy question. Okay? If the team is unable or unwilling to provide the correct answer, the team will lose the points or the score assigned to that question. The important thing is do not use the buzzer if your team is unwilling to answer the question. So just don't buzz the thing and then think about the answer. If you're not willing to answer the question, then don't buzz the buzzer. The points will be awarded to the team which provides the correct answer when called upon, not just everybody buzzing in. Any questions so far on the buzzer? So it's locked in when the question is read. It's opened up by me when the question ends. And then I call out on first, second, and third. Okay. If a team provides an answer when not called upon, which is the first offense, out of turn answer, that team will receive a warning and the question will be thrown out. No points will be awarded or deducted, which is first offense, out of turn answer. If the first fastest team is unwilling or unable to answer the question, then the controller will indicate the second fastest team that has buzzed in, and the team must provide the answer. And if the second team is unable to provide, then it'll go to the third. Only the first, second, and third fastest buzz teams will answer the question, and they have the opportunity to answer the question provided. The ones which are fourth, fifth, sixth, and so on and so forth will not lose or point or get any points. So it's only 1, 2, or 3. In the event there is a debate regarding what question is provided, a virtual judge will weigh in and provide their expert opinion. The team which correctly answers the question has control of the board and will be asked to choose the next question or category to answer. If no one correctly answers the question, the team which had the control for the unanswered question retains the control of the board. Any questions so far on the sequence? Because I think it's important to go through these before we have any kind of debate while the program is going on. Okay. The buzzer controller, which is me, will assign approximately 25 minutes per round. So 25 minutes, we start that. And at the end of the assigned 25 minutes, which I'm watching here, the question board will be locked down and the game will proceed to either the audience question, which is that 5-minute break that we give between the single Jeopardy and the double Jeopardy, or the final Jeopardy question at the end of the double Jeopardy rounds. So Kechi is trying to keep everything in time because we have another round to go to, okay? If you have any questions, you should contact the buzzer controller, which is me, via the chat box. Everybody know where the chat box is? So on the bottom, you have the participants, you have the question and answer, and then you have the chat box, and then the share screen. The share screen and record will not be used by any of the teams because this is for us. The only thing is the chat box. So you can go up on the chat box, and then I can type in here. So you should have gotten that for all the panelists, okay? So if you want to contact just the buzzer controller, you should find me in there. Do you find me there? So you should have me as the panelist. And then text to me so that I can moderate this anytime, because there are going to be technical difficulties, both from your side and from my side. You should contact me, and at that time, we can switch out the electronic device or the online buzzer, and then there is a brief timeout that will be called out for the entire game. So we should test this out during this session so that if we have any technical difficulties, we should get that straightened out before the session starts. There is no additional time will be added to the game schedule to accommodate these timeout sessions. So the more timeout sessions we have, less time we have to go through our round of questions. Any questions so far? So before we move on to the daily double section, Kechi, anything that you want to go through?
No, I think you should go ahead and test the buzzers for them.
Okay. Okay, so I'm going to generate a game code. And then I'm going to post it as ACC Michigan, and then I'm going to share the code right now. So you should be on ccg.buzz. Is that what they use to get on it?
Yes.
Okay, so did everybody get the buzzer code? M as in Mary, X as in X-ray, J as in Jack, Y as in yellow. Please type that in. I typed in the website ccg.buzz, ccg.buzz.
If you're using a cell phone to access the buzzer system, switch off the sleep mode on your phone. Let your phone remain on at all times. Otherwise, you'll be kicked out of the buzzer system. So if you're using a cell phone, make sure your phone does not go on sleep mode.
So I'm going to read out who are appearing here. I have Red as Spectrum Health. I have them here. And then I have Beaumont Royal Oak, Team 8. Those are the only teams I have here. So I'm waiting for others to get in.
Please, when you log into the buzzer system, label yourself as Team 1, Team 2, Team 3. You can put your institution after the number, but we need to see the name because the buzzer code controller will use your number, Team 1, to identify you on the system. So put in Team 1 as your team name or title, and you can put what your institution after the number, but make sure your number is showing up.
And hit join.
And hit join. Thank you.
So the team name should appear as the number of the team, right, Kechi?
Yes.
So I would ask Spectrum Health to change their name. I would ask Beaumont Royal Oak to switch up from team to name. Please name your team. The name should be Team 8 and team should be Royal Oak.
You can log out and come back in again.
Kechi, I can refresh this by turning off and turning on, correct?
I believe so, but Sada actually knows better about that portion.
Yeah, I think actually you can't remember it now. Sorry.
That's all right. We'll test it out here. So I have Beaumont Royal Oak Team 8. That should be switched out. So let me refresh it again and see if I get everybody. Perfect. Beaumont Royal Oak is Team 8. It's right there. Team 3, Henry Ford, very good. Team 2, Spectrum, please change, flip it out from team to name. So the name is David Breska. I want that to be turned, flipped around. Same with Providence Ascension, team 4 should be flipped. I have team 6, Ascension St. John, and that's in the correct order. Waiting for others to come in. I have team 5 in the right order. Thank you, Beaumont Dearborn. I have team 2. Yeah,
Dr. Rao, do you have team 12 there?
we do, but we have you to switch from team to name. So the name says Ascension Genesis, team says team 12. So just switch around the name as team.
Is team 7 appropriate?
I'm sorry, which one?
Team 7.
Team 7 is appropriate.
Team 9, is that good to go?
Dr. Rao, can you check team 11?
Team 11, it has to be switched around, please. McLaurin McComb. Team 2, red, is correct. Spectrum Health.
It seems like they're having audio problems and they can't hear the conversation.
Okay, can you hear me?
Number, and we would like that to be admitted into the meeting if possible. I can give you the phone number. I did send it to Liliana.
So when you're calling in, you just need to call in. I don't need to admit you.
It said that the meeting hasn't started.
Ah, okay.
And then it just ended our call. So when we call in, it just says the meeting hasn't started. So typically we would have to be allowed into the meeting because we'd be put in the waiting room.
Yeah, so that's an attendee. Someone here is on their phone, I believe, one of our moderators. Who's on their phone? Is that Joe? Are you on your phone? And if so, how did you gain access?
I just logged on Zoom from both my iPad and my laptop, so I can.
Ah, okay.
Yeah, we're calling it through a landline because we have a speakerphone that we can mute and unmute.
So it is, I know that as soon as we open it up to attendees, I can allow you sound access.
Sure. Can you give us one moment? We're going to call back in because that ended our call because we were waiting for a while. I've experienced this in the past. If you go to the attendees, you can turn them into panelists. Like you can hover over the phone number. I've done that before.
Yeah.
Okay.
It won't allow me to do it until we open the meeting to attendees. So
Okay.
let me write down, I'll make sure I've got your phone number.
Perfect. Yeah, we're calling right back in. Let me know. I did send it in the chat, but yep, we should be fine. Other than that, we can hear though.
So I would ask everyone to buzz in again. Let's see. So I'm going to call out what I have here. Obviously, the order doesn't matter. So I have team 5 in the correct order. I have team 8, Beaumont Royal Oak, in the correct order. I have team 12, Genesis, in the correct order. I have team 1, Farmington Hills, Beaumont, in correct order. I have team 10 in the right order. I have team 2, Spectrum, in the right order. Team 11 in the right order. Team 4 in the right order, and team 9. So I'm missing team 6, and I am missing team 7.
Team 6, we're logged in and we tried to buzz. Did you get our buzz?
I got it now. Thank you. So
We just asked you, you said it was appropriate.
Yeah. Which team? I'm sorry.
Team 7.
Team 7. I don't see team 7 again. Go ahead and buzz again, please. Yeah, and I see you, but switch around, please, Wayne State. Just flip it.
Can you guys hear us with the new audio?
I can hear you. So go ahead and switch Team 7, Wayne State. Perfect. I have both of you as 11 and 12, but that's okay. At least it's in there. Any questions so far? So all the teams are in here. So let me count because it's out of order. I'm going to make sure that everything is there. I have team 1. I have team 2. I don't have team 3. Henry Ford. I see it now. So I should have 12 of them. So I have 13 because Wayne State is buzzed in twice, which is okay. The order is correct. So we should be good.
All right,
So
Sunil, why don't you test it one more time? I want you to lock the buzzer so they can see when it's locked. It will
Okay.
be grayed out, and then you tell them, you know, that you're unlocking it, and I want everyone to practice again, and I want to make sure they're comfortable with the buzzer system. So go
Okay.
ahead and test it one more time. Thank you.
Okay, so I'm going to turn off the buzzers now. And then turn on the buzzer now. So all the teams are coming in. Okay. So I want you to understand the rapidity of pressing the buzzer, because if you understand the buzzer, you can get in there faster. So for example, I got team 3, team 2, and team 8 as the first 3 teams that got into the buzzer. So I have team, let me make sure I got everybody here. I have team 1, and the team 10 came very last. So we have to test it again so everybody has the opportunity. Any questions? I have all the teams here in the right order. So we got that part taken care of, Kechi. So I would like to give them another opportunity to get in there. So I'm going to turn off the buzzer and turn on the buzzer. And then let me see how the responses come. So I turned off the buzzer, and Salah finished his question, so I'm turning on the buzzer. Perfect.
So remember, everyone, that when your moderator, Dr. Abison, reads the last word on the board, that's when Sunil is going to open the buzzer. So if you're pressing your buzzer while Dr. Abison is still reading, it's not going to go through. So Dr. Sunil will only open the buzzer when Dr. Abison has read the last word on the screen, and then you can buzz in. Okay, I'm going to let we have 2 more minutes. Dr. Abison, go ahead and say any introductions or words to the team.
Yeah, I think Sunil Rao covered it really well as far as how the game will be played. So yeah, as highlighted by everybody. So the key thing is just to get your buzzers in, just to find the right time to buzz yourself in. After that, the question answering is actually the easy part, because you'll be able to answer most of the questions, hopefully. We don't have a lot of tricks in there, so that's good. So I think we're all set.
And then what Sunil was trying to say, thank you, Dr. Abison, is that the daily double is only for the team that is in control of the board. So the daily double question, there's a daily double question in the first round and in the second round. You can wager as much as you want. If you have 1,000 points and you want to wager all 1,000, you can go ahead. If you want to wager 0, you can do that as well. If you're in the negative, you can wager as much as $400 in the first round or $800 in the second round. So that's for the daily double, only for the person or team in control of the board. For the final Jeopardy, only teams that have money on the board will participate in the final Jeopardy. And in final Jeopardy, the moderator will remind you to switch your chat box to him, because you will send in your wager amounts directly to Dr. Abison in the chat box. And you also send your final Jeopardy answer directly to Dr. Abison in the chat box. Is that clear? All right.
All right. So before we start, 2 disclaimers. one, let's have some fun. So it's not like one came early, one came later, which is going to happen. And two, I also have a second to press the button here. So I'm not that fast as you think. I'm not the computer. So there may be a little delay. And if so, please pardon me. And if you want to have any argument, I'll provide my cell number and you can call me later, okay? All right. So Ketchy, can we start? Right on time at 9 o'clock? Okay, so I'm going to turn off the buzzers and then Salah, go ahead and take over.
Yeah, so we go ahead. I don't think we have a practice Jeopardy. We just go ahead with the questions, right?
That is correct.
Okay, so you should be able to see the screen. Just want to do something here. Okay, that should be fine. Okay, so then to start off, Ketchy.
Yes, introduce the teams for the audience, please. So let's have them all briefly say who they are and introduce yourself as well, and who the rest of your crew.
Oh, okay.
Thank
Yeah, that's the important part. Okay, so we're starting our Jeopardy competition. My name is Salah Abusin. I'm intervention cardiologist at Rush and your moderator for today. So with me is Dr. Joe Tan. He'll be the scorekeeper. Dr. Sunil Rao, buzzer controller, and Ketchy is is kind of like our big boss. She's the one who tells us what to do. She's doing a great job. And we have Liana from the American College of Cardiology. So we're going to go around every team, and then when your name comes up, so just introduce yourself. So we'll start off with team one.
Hi, Alex.
Tarhana.
I'm Mike.
All right, nice to see all of you. And which team are you? Where are you from?
Beaumont Farmington Hills.
Okay, welcome to the Jeopardy competition. Team two. Team two.
Hey, can you hear us now?
Yeah, we can hear you now.
Okay, we're the Spectrum Health team from Grand Rapids. I'm David Briscoe.
I'm Malif Parikh. Jose.
Nice to meet you all. Team three.
Hi, we're Henry Ford. I'm Edward Gilder.
Alex Michaels.
Mohammed Rad.
Nice to meet you all. Team four.
Providence Hospital. My name is Mathar.
Mine. Andrew Asal.
Nice to meet you all. Team five.
Hi, Beaumont Dearborn. I'm Marie Bernardo.
Steve Lynch. Ahmad Ali.
Hi, all of you. Team six.
Hello, everyone. We're Ascension St. John, Detroit, and I'm Rad Sacco.
Phil Venditelli.
And Tarek Marouche.
Nice to meet you all. Team seven.
Hey, this is Wayne State. My name is Kartik. Look at that.
Ahmed. Vivek.
Team eight.
Hi, this is Beaumont. I'm Arun.
Travis.
Akash.
Nice to meet you all. Team nine.
Hi, we're Ascension Macomb. Streaker.
Harjo Grover.
Faiza Chowdhury.
Nice to meet you all. Team 10.
Hi, this is Fair Hospital. Sardar. George.
Nice to meet you all. Team 11.
Hi, McClure Macomb, Victor Hunyadi.
Hey, this is Wasim Lala.
Adam Bykowski.
Nice to meet you all. Team 12.
Hey, this is Ascension Genesis. I'm Omar.
Ira.
Anubhav.
Okay, nice to meet you all. So we'll start off with the first question, and it's going to be critical care medicine for $100. Now, can everybody see the screen?
Yes.
Yes, we can. Dr. Sala, just a quick question. I think the audience is having a bit issues hearing you. We want you to ask that you talk directly into the microphone.
That's what I'm doing. Okay. All right.
Sorry.
All right. Can you hear me now? So I'll speak up. Is that better?
Much better.
Okay. So there was one person who mentioned that. So that's team 5. Can you hear me clearly?
Yeah, it's much better now.
Okay, all right. So we'll go ahead with the first question. It's going to be critical care medicine for $100. Okay, so a 58-year-old man presents with hypotension, increased JVP, clear lungs, and an S3 on auscultation. His ECG is shown. The clinical diagnosis is constrictive pericarditis, cardiac tamponade, restrictive pericarditis, or RV infarct.
So I've opened up. Team 3, Henry Ford goes first.
What is RV infarct?
Yes, well done. And that is team 4?
Team 3.
Team 3, Henry Ford.
Team 3. Okay, so I just need the number. Okay, well done, team 3. So now when I click on it, your number should change. So
Okay, turning off the buzzers.
Okay, good. So that's what is RV infarction? Good job. In patients presenting with an inferior STEMI, RV infarction is suggested by ST elevation in 3 more than 2, ST elevation in V1, and ST depression in V2. And the patient had the triad of clear lungs, increased JVP, and hypotension. So good job, team 3. So team 3, the board is yours. Where do you want to go?
We'll stay with critical care 200.
Okay, good. Okay, critical care for 200. The hemodynamic effects of milrinone includes the following: increased cardiac output, increased heart rate, and this effect on systemic vascular resistance.
Team 2, red spectrum.
What is decrease?
Excellent, well done. So, yeah, so that's decreased systemic vascular resistance, and that's because milrinone does that. So good job. All right, so we go back to the board. The board is yours, team 2. So what do you want to do?
Let's do critical care medicine for 300, please.
All right. Vasopressin produces this effect on systemic vascular resistance.
Team 3, Henry Ford.
What is increase?
Well done. And that is team
3.
Team. Okay. All right. So yeah, increased systemic vascular resistance. Vasopressin is a pressor, so pressors make the systemic vascular resistance go up. So team 3, the board is yours. Where do you want to go?
We'll keep going with critical care medicine.
Okay. All right, so critical care medicine for 400, the diagnosis shown by the hemodynamic tracing is it A, cardiac tamponade, B, RV failure, C, constrictive pericarditis, D, restrictive pericarditis?
Team 8, Beaumont Royal Oak.
Okay, team 8.
C, constrictive pericarditis.
And that is incorrect.
Next team is Team 7, Wayne State.
D, restrictive pericarditis.
And unfortunately, that is also
incorrect.
team 7, right?
Next team is Team 11, McLaren Macomb.
Oh, we didn't even get third. We didn't even get third.
What is A, cardiac tamponade?
Yeah, tamponade. Lost your Y and your die.
And that's which team is that?
Team 11, McLaren McComb answered A, cardiac tamponade.
Yeah.
So they get the board.
Okay, just a minute.
Yeah, almost looks like it was concordance though.
Okay, so again, which team?
There's really nothing
Yeah.
here now.
Which is weird because you would think you lose your Y, you would want a
11.
JVP, like a right atrial, no?
Okay, we'll just
we can
down
hear you.
in a second. Let me just get the scoring right. So who was the last person who answered?
Team 11, McLaren Macomb got the points, and I would ask other.
That's the incorrect, but that was the incorrect answer.
Yeah.
Yeah, that was the incorrect answer. So the correct answer is RV failure. And the main point here is there's discrepancy between the RV and the LVDP. So the RVDP rises above the LVDP, and that is RV failure, okay? So we'll go back to the board again. And then, so then I guess I pick, because everybody got it wrong, so then I pick the next one. So I'm going to choose, what's that?
Team 3 was the last one that got it right. So
Oh,
team
okay.
3's the last board.
All right, so team 3, you can go ahead. Thanks, Joe. Team 3, you
Yeah.
have the board.
We'll do coronary artery disease for 100.
Coronary artery disease for 100. Is that what you said?
Yes.
Okay, very good. So coronary artery disease for 100, the source of error in this FFR tracing is, hint, the pressure gradient without a change in distal pressure morphology. Is it lack of equalization, drift, use of side hole guide catheter, or wrong adenosine dose?
Team 4, Ascension Providence.
Is drift.
Okay, unfortunately, that's incorrect. Which team number was that?
Team 4, Ascension Providence, got it wrong. The next opportunity is Team 5.
Lack of equalization.
Well done.
So Team 5 gets the board and gets the points.
So that is lack of equalization, as you point, because the pressure tracings are identical to each other and they're not ventricularized. So you have the board.
Coronary artery disease 200.
Okay. Coronary artery disease for 200. This PTY12 ADP receptor antagonist should not be used prior to diagnostic angiogram in patients with non-STEMI. Is it clopidogrel, ticagrelor, prasugrel, or vorapaxar?
Team 5, Beaumont Dearborn.
Bro.
What was that?
Prasugrel.
Well done. Excellent. Good job. So that was prasugrel, and that's the only one. You shouldn't give it upstream. All right. So you have the board.
300. Coronary artery disease.
So this agent leads to inhibition of factor 10. Is it fondaparinux, iptifatide, abscimab, or cangrelor?
Team 12, Genesis.
Wait, no, what is one is for not
Okay, well done.
What is A?
You got it right. What is fondaparinux? Okay, so this is a factor 10A, and the clue was in the fact that it was subcutaneous. So that was an easy question. Okay, so you have the board. Where do you want to go?
Let's go with coronary disease for 400.
Okay. So monotherapy with this drug has been associated with catheter-associated thrombosis during PCI. Is it heparin, fondaparinux, or enoxaparin?
Team 9, Ascension Macomb.
What is B, fondaparinol?
Okay, well done. All right, so you have the board. Where do you want to go?
We'll take valvular heart disease for 100, please.
Okay.
We're just so excited.
Okay, valvular heart disease for 100. So the cardiac output is 7.2 liters per minute. Use the tracing below. The approximate aortic valve area is.
Team 8, Beaumont Royal Oak.
Approximately 1 centimeter square.
Okay, well done. Good job. So the main thing is that they want you to know the Hackio equation. Okay, so it's 1 centimeter squared. So you divide the cardiac output by the root of the peak or the mean gradient. So the difference was about 52. So if you root the 52, it comes out at 7.2. Divide that by the cardiac output, you get 1. Okay, so the board is yours. Where do you want to go?
Valvular for 400.
You want to go for 400, valvular? Is that right? Valvular for 400?
Yeah.
Okay, very good. All right, so there's a sound. I don't know if you can hear it or not. Okay. 64-year-old man presents with dyspnea on exertion. The audio file is the heart sound at the third left intercostal space. His abdominal aortic Doppler is shown. The diagnosis is it A, aortic stenosis, B, aortic regurgitation, C, mitral regurgitation with an abdominal aortic aneurysm?
Team 4, Ascension Providence.
What is aortic regurgitation?
Well done. So even if you didn't hear the sound, you can actually see that the pathognomic tracing of whole diastolic reversal of flow. So the board is yours. Where do you want to go?
Valvular heart disease 200.
So with increasing severity of mitral stenosis, this happens to the S2 opening snap interval. Does it increase? Does it decrease? No change, or depends if you have aortic stenosis?
Team 12, Genesis.
What is decreases?
Well done. Yeah, so it's an inverse relationship, right? Yeah, so it decreases the interval between S2 and the opening snap. So the board is yours. Where do you want to go?
Let's do valvular heart for 300.
Okay. So the diagnosis of this tracing, is it aortic stenosis, hypertrophic obstructive cardiomyopathy, paravalvular leak, or myocardial infarction?
Team 9, Ascension Macomb.
What is B, hypertrophic obstructive cardiomyopathy?
Well done. So you have the classical broken burr sign. So you can see there's a fall in the aortic pressure with a rise in the intracavitary pressure. All right, so the board is yours. Where do you want to go?
We'll do pill effects for $100, please.
Okay. So aldosterone antagonists, spironolactone, should not be used in patients with serum creatinine more than 2.5 or serum potassium levels which exceed this level.
Team 9, Ascension Macomb.
What is 5?
Well done. So serum potassium more than 5. Okay, so the board is yours. Where do you want to go?
We'll go with pill effects for 200, please.
So a 50-year-old man with hypertension, dyslipidemia, and CAD had a recent stent to the LAD, comes into the emergency room with dyspnea. His vitals are heart rate of 120/78, blood pressure 120/78, heart rate 45, respiratory rate 16. His BNP is 60. His creatinine is 0.8, and his troponins are negative. He's taking aspirin, ticagrelor, rosuvastatin, and losartan. His chest X-ray is normal, and his TTE shows an LVEF of 60%. The medication culprit for his symptoms is?
Team 2, Red, Spectrum Health.
Okay, team
What is
2.
ticagrelor?
Well done. All right, so team 2, you have the board. So it is ticagrelor, it causes shortness of breath, which happens shortly after taking it. And that's why they have no other abnormalities on examination or on testing. So team 2, the board is yours. Where do you want to go?
Let's do pill effects for 300, please.
Okay. Okay, so we're talking about drug-drug interactions here. So drug-drug interactions can occur in patients with heart failure with reduced ejection fraction. Provide the correct effect of these drugs on warfarin's INR levels. Amiodarone increases the INR, phenytoin decreases the INR. What does Bactrim do to the INR?
Team 12, Genesis.
Team 4?
Team 12, Genesis.
Okay, team 12, what's your answer?
What is increases?
Increases, well done. So it is an enzyme inhibitor. So it increases the INR. Okay, what is increased INR? And these are the drug-to-drug interactions. Okay, so that was team 12, right?
That's right.
Correct.
Okay, so team 12, the board is yours. Where do you want to go?
Pill effects for 400.
Okay. An 80-year-old man with diabetes, hypertension, and heart failure with reduced ejection fraction and coronary artery disease presents for evaluation of pain in his perineum that's getting progressively worse. He also noticed a black color change on the skin around his groin. His blood pressure is okay. His heart rate is 45 beats per minute. Respiratory rate is 16. He's on aspirin, carvedilol, rosuvastatin, losartan, metformin, dapagliflozin. The medication culprit for his symptoms is?
Team 10.
Dapagliflozin?
Well done. Yeah, so that's one of the side effects of these new SGLT2 inhibitors. They cause vaginal infections, bionitis, and sometimes it can be quite serious. All right, so the board is yours. Where do you want to go?
Can I ask a question real quick? Do we need to phrase it as a question or no?
Well, it seems that people have been getting away with it, so.
It's okay. You don't have to phrase it as a question.
Okay, so who has the board?
Can we go to 100? Preventive cardiology. 100?
Okay.
In preventive.
All right, so preventive cardiology for 100. The primary mechanism of action of ezetimibe is inhibition of cholesterol absorption, inhibition of a key enzyme in the mevalonate pathway, stimulates cellular fatty acid uptake, increase hepatic production of VLDL.
Team 5, Beaumont Dearborn.
A, inhibition of cholesterol absorption.
Okay, well done. And that's what it does. Okay, team 5, the board is yours.
We'll do preventative 200.
Okay, so preventive for 200. The strongest prognostic variable in an exercise stress test is rise in pulse pressure, maximum heart rate achieved, exercise duration, or rise in blood pressure.
Team 10.
Okay, team 2.
C, exercise duration?
Yes, you said exercise duration?
Yes.
I think that's what you said, yeah. Well done.
Yeah.
That's the strongest prognostic variable. Okay, the board is yours. Where do you want to go?
300?
300. So the mechanism of action of empagliflozin is?
Team 12, Genesis.
What is SGLT2 receptor inhibition?
Okay. So actually, I will accept that. Which team are you?
12.
Okay. Yeah. So the formal answer is sodium glucose co-transporter 2 inhibition, but you got the right answer. So the board is yours. Where do you want to go?
I guess we'll do the last one.
Yeah, I don't think you're going anywhere else, right? Okay. All right, good. So now the predominant site of pro-protein convertase saptoleucin kexin type 9 or PCSK9 enzyme production is it the liver, intestine, bile duct, or is it the vascular endothelium?
Team 2, Spectrum Health.
Okay.
What is A, liver?
Okay, well done. And that's the correct answer. So it is, it's predominantly produced in the liver. Okay, so.
So that completes the board, and we're 2 minutes away from the 25-minute mark. So I think we got it on time.
Yeah. Well, we didn't get the daily double, right?
We didn't have a daily double there.
Yeah. Okay.
So we can go through the scores, I believe.
Well, we can, yeah. Dr. Abbasi, why don't you let the audience know where each team stands?
Yeah, so I think the The leading is Team 12 with 1,100 points, followed by Team 2 and Team 9 at 800 points. At 600 points, we have Team 10. And then we have Team 5 and Team 3 at 400 points. Then Team 4 at 300. And then we have Team 6, 30, well, 30 and 40 don't count, but Team 6 and Team 1 at 0 points. Then we have Team 7, no, Team 8 at minus 300, and Team 11 was Team 7 at minus 400 points.
Yes, and so thank you, Dr. Salah. Dr. Abbasid, Dr. Rao, do you want to let the audience know what the teams are in terms of the numbers and their corresponding institutions?
Sure. Team 1 is Farmington Beaumont. Team 2 is Spectrum. Team 3 is Henry Ford Hospital at 400. Team 4, Providence Ascension at 300. Team 5, Beaumont Dearborn at 400. Team 6, Ascension St. John at 0. Team 7, Wayne State, negative 400. Team 8, Beaumont Royal Oak at negative 300. Team 9, Ascension Macomb at 800. Team 10, Michigan State Sparrow at 600. Team 11, McLaren Macomb at negative 400. And Team 12, Ascension Genesis at 1100.
Thank you so much, Dr. Rao. And I think we can now go to, someone saying a high five there. Let's go to the break, and Dr. Rao, you can take it away with the audience question.
So I'm going to use the share screen.
Just if you don't mind, Dr. Rao, we had privately messaged you earlier, and I just want to know out of curiosity, did you get any of our buzzes, Team 6, St. John Hospital?
Yes, we did.
Okay, sounds good. Thank you.
So did
Dr.
you
use the new buzzer, verifying that's in Team 11. We just switched our buzzer out.
Okay, so I think we will test the buzzers again before we go. Just to answer Team 6's concern, were you thinking that you were not on there at all, or were you not getting the option?
I mean, honestly, we buzzed like multiple, like pretty much every question we buzzed, even if we didn't know it, just to see if we're in the game at all. And it doesn't seem like you were calling on teams even before we get the option to buzz, which is.
Yeah, our buzzer wasn't even open before you'd already state who's answering.
Which team to answer.
This is Wayne State.
Okay, so Wayne State didn't get the opportunity, and Team 6, St. John, didn't get the opportunity.
Yeah,
So,
I believe it has to do with the Wi-Fi. I don't know.
Probably the internet.
Yeah, many times.
We changed from wireless to even to the hospital. Like we tried 2 different ones to see if it gets faster, but it didn't change anything. Before we get the option to buzz, he was already pronouncing the teams.
Yeah, we've been pretty much buzzing every question, but we got to answer 3 fortunately. But I think everybody's just trying to buzz right in the beginning there.
Practice the buzzer again, so we make sure it's working. Into that, Dr. Rao?
Yeah, let's go back to the buzzer again. So I'm going, right now it's off. I'm going to let actually not everybody buzz. Let's see the teams that had issues were St. John, Team 6, and Wayne State. So I'm going to ask them to buzz in. So I'm opening it up right now. Do you see that it's closed right now? Okay.
We were supposed to do it.
So I got Team 10 as the first person, even though I asked them not to buzz, but that's all right. Team 6 is at number 4. And the Wayne State Team 7 is also there at number 2.
Did you get McLaren Macomb at all? You just buzzed in.
McLaren Macomb, yes. Team 5. I got everybody.
Yeah, it's probably our internet.
Okay, so just making sure where the issue is, because we want to give opportunity for everybody. Team 6, you were there, so I guess it's the internet part. So I guess the technical difficulties are something that we can't.
Right. Thank you.
Here. All right. Okay,
And
hopefully.
please, and also if during the game, because what you said, if at any time during the game you want to switch out your buzzer, let Dr. Rao know and he would do a timeout. We don't want you to spend time switching your buzzer and missing out on the game. So if you want to switch out your buzzer, let him know and he will take a pause, a timeout for everyone, okay?
Okay, why don't I provide my cell number to everyone in case I'm not looking at the chat box? I'm going to type in the cell number. You can text me and I have a buzzer beep there so I can look at that so that in case I don't get it. So I'm going to send my cell number to everybody.
Dr. Rao, this is St. John, Team 6. We would like to switch our buzzer. So would be great if you can test it out for us.
Okay, all right. So Kechi, should I resend a new code or they just switch out the new buzzer?
They can just switch it out. And then if they want to use a cell phone, sometimes that may be faster for them if their cell phone internet is better.
We were using, so now we're switching to a laptop.
Okay.
Okay. So I'm going to close the buzzer and test it out again. So did Team 6 switched out the buzzer?
Yes.
Okay, I'm going to open it up.
That's better.
Yep, I saw Team 7 as number 1, Team 6 as number 2, Team 5 as number 3, Team 3 as number 4, Team 8, Team 2, Team 11, Team 12, Team 9, Team 4, and Team 10, and Team 1 in the end, Beaumont, Farmington Hills. So I have all the teams in there. So I just want to make sure the contestants are happy with the system before we move on. We do not want anybody to have any disadvantage. And you should have my cell number there and my cell phone is on here. If I don't see it there, please text me. All right. So we'll go forward with the audience question right now. So the contestants don't get to answer this. There is no points involved. Of course, the audience will get a prize. So I'm going to open up the presentation. It's going to be one slide and one answer. Kechi, do I share the screen once I get there?
Yes, you can take over your screen share.
Okay. So I have the slides on. Hopefully all the 3 slides don't show up there when I'm sharing it, but I'll try. So are you able to see only the first slide, hopefully?
No, we're seeing everything.
Okay.
Go to presentation mode.
Okay. How about now?
Yes.
Okay, so audience question 1 for round 1 for today. Audience members should submit their answers in the chat box. Now, the only thing is I can't see the chat box here, so I'm going to make sure that I get the chat box here. Okay. So I'm going to open up with the question. Audience members should submit their answers in the chat box. The first correct answer will win a $30 Amazon gift card.
Dr. Rao, you're in presenter mode, so they're going to see the answer at the same time as the question.
Thank you for letting me know.
The 200.
Okay. Can you see? How about this? How about this? How about this? Do you see anything there?
We can see both. That's okay.
If you just go to the top, if you go to the top where it says slideshow, you can just go from the first slide and that should help.
Okay. All right. Right there.
I think it's already showing the answer.
Yep. All the answers are there from beginning. There you go. Is that the one? Sorry.
Yes, you got it. I think the answers are already there, but yes, that should be what works.
All right. You got the answer.
Well, I guess this is going to be a freebie. Anyone can put the answer in and they'll get the $30, I guess.
Did anybody put it in at least? So which
Yes.
one of the diagrams correctly depicts the impella? Figure A, figure B, both figures, or none? There you go.
Box so we can send you a gift card.
Yeah.
Dr. Yusuf
no.
Ali.
So the answer is figure A, both preload and afterload are reduced in impella, and the stroke volume and cardiac output are also reduced. However, the total cardiac output is increased as a result of active pumping of the impella. Figure B is consistent with the balloon pump on the PV loop, which is reduced afterload and increased stroke volume. So there goes whoever signed in. Sorry about that. Okay, I am going to get out of sharing. Okay, they have done enough damage, so I'll give it back to Dr. Sala. So let's test out the buzzer, Sketchy, again.
Yes, please.
So is everybody back? Okay, I'm going to test the buzzers, and I'm going to make sure all the 12 teams are there. So far, I have team 7, team 2, team 3, team 11, team 10, team 6, team 1, team 12, team 9, team 8, and team 4. And the last one is team 5. So everybody came through. Just to make sure, team 6 came through, and Wayne State came through also. All right. I will pass it on to Dr. Sala.
Can people see this?
Yes.
Okay. Shall we go right ahead?
We'll go with complicated. It's complicated for 200.
Okay. All right, so it's complicated for 200. All right, now we have the daily double, right? Okay, so how much do you want to wager?
800, please.
Just to clarify, nobody buzzes in, right? Just
Yeah, nobody buzzes in now. It's just the team that had the board. All right, so let's go to the daily double. All right, so that's confusing. Supposed to go to the daily double question. This is not the daily double question. Right, Ketchy?
This is the right one.
So do they get? So do they?
No, this.
Oh, okay, so they just answer this one then, right?
They just answer the. This is just a regular question. Go ahead and answer.
Okay.
What is B, papillary muscle rupture?
Okay, good. So excellent. So that was, which team was that?
Spectrum.
Team 2.
Team 2 spectrum.
Oh yeah, so you got the correct answer. So the main thing about this question was the papillary muscle rupture can have a very soft or absent murmur, unlike a VSD, which causes a loud murmur. Okay, so the board is yours. Where do you want to go?
Let's do it's complicated for 400, please.
All right, good. So it's complicated for 400. So this classic triad of this inferior ST elevation and MI complication is hypotension, elevated JVP, and clear lungs.
Team 9, Ascension Macomb.
What is RV infarction?
Well done. So that's we had that question in the first round. So this is RV infarction. So now the board is yours. Where do you want to go?
I'll do, it's complicated for 600, please.
So ventricular fibrillation, which occurs after this duration in hours following a STEMI, is associated with an increased risk of sudden cardiac death.
Team 7, Wayne State.
48 hours.
Well done, excellent. What is 48 hours? So when you have it less than 48 hours, you still have, the prognosis is not as dismal as if it's more than 48 hours. So the board is yours. Where do you want to go?
We'll take it's complicated for 800.
It's complicated for 800. In this rapid fatal complication of STEMI, patients develop cardiac tamponade followed by pulseless electrical activity. The vessel infrequently involves the obtuse marginal, the ramus, the right coronary artery.
Team 8, Beaumont Royal Oak.
CRCA.
Well done, excellent. So it's usually this is a pre-wall rupture. It's a high lateral, so that includes diagonal ramus, but rarely the RCA. The board is yours. Where do you want to go?
800. Have you got the juice?
800. Have you got the juice? This class 1A antiarrhythmic is used to treat the rhythm below.
Team 6.
What is procainamide?
Well done. That was team 6, right?
Correct.
Good job. So that's procainamide. And that the rhythm you saw was an AFib with WW.
Can we pause for a second? Our buzzer disconnected.
Okay.
Okay, let's pause. And I'm going to, once you're on, let me know. We're going to do the test.
Okay, you do.
I think we're back in. Do you want to test it?
Yep, let me test it. This is just a test. I have team 12, team 4, team 5, team 7, team 11, team 8, team 1, team 6, team 9, team 10, team 3. I'm missing one. I don't see team 9, I believe. Can team 9 buzz? I do see team 9. There you go, team 2. Thank you. Let's go back. Board is yours, Salah.
Who had control? Who just scored this question?
Team 6.
Team 6.
All right, team 6, you have the board. So what do you want to do?
We'll pick 2 clear or not clear, 200.
To clear or not clear for 200. So routine preoperative 12-lead ECG is not recommended. It's class 3 in this situation. So you have to be specific with this answer. Okay.
Team 12, Genesis.
Low risk for low risk procedure.
What did you say?
What is low risk, low perioperative cardiac risk for low risk surgery?
Okay. That's not what we're looking for. So go to the next one.
Team 5, Beaumont Dearborn.
Asymptomatic low risk.
Yeah, that's the key. The asymptomatic low risk. That's the answer. That was team 5, right?
That is correct.
Yeah, so that's what we're looking for. That word asymptomatic. You were very close and you were probably right, but that's not that's not what we're looking for. Okay, so the board is yours. Where do you want to go?
Want to clear this 400?
Yeah, just keep.
To clear or not to clear 400.
Okay, to clear or not to clear for 400. The CARP trial demonstrated no survival benefit in routine preoperative revascularization in patients undergoing this non-cardiac surgery. Is it carotid endarterectomy, intraperineal surgery, intrathoracic surgery, or abdominal aortic aneurysm surgery?
Team 2 red, Spectrum Health.
What is A, carotid endarterectomy?
Unfortunately, that's incorrect.
Team 8, Beaumont Royal Oak.
What is D?
Well done. So yeah, so it was abdominal aortic aneurysm surgery and lower extremity surgery. It was not carotid endarterectomy. All right, the board is yours. Where do you want to go?
Killing me softly.
800, killing me softly.
800, killing me softly. This antihypertensive drug should be initiated in patients with resistant hypertension or hypertension with primary hyperaldosteronism.
Team 10,
Spironolactone?
What's that?
Spironolactone?
Well done. Good job. What is spironolactone? We would have accepted eplerenone. And that is adding a mineralocorticoid receptor antagonist is indicated as per the 2017 guidelines. The board is yours. Where do you want to go?
Can you go for 200 for have you got the juice?
Have you got the juice for 200?
Yes.
This class of medication is recommended as the mainstay of treatment in patients with a clinical diagnosis of long QT syndrome and suggested in patients with silent genotype positive, phenotype negative long QT syndrome.
Team 7, Wayne State.
What is Nadolol or beta blocker?
Okay, I'll take accept beta blocker. That is the correct answer. Well done. Okay, so the board is yours. Where do you want to go?
We'll take have you got the juice for 400.
Have you got the juice for 400? This Vaughan-Williams class 3 antiarrhythmic agent should not be used in conjunction with thiazide diuretics. Is it amiodarone, dronedarone, sotalol, or dofetilide?
Team 7, Wayne State.
What is dofetilide?
Well done, excellent. So that's one of those peculiar, interactions that commonly forgotten. That's why you need to do a special online thing before you can prescribe it. Okay, where do you want to go?
We'll take got the juice for 600.
Have you got the juice for 600? Unlike other class 3 agents, this antiarrhythmic agent increases the defibrillation threshold of AICDs. Is it amiodarone, dronedarone, sotalol, or dofetilide?
Team 1, Beaumont Farmington Hills.
What is amiodarone?
Well done, excellent. So unlike the other class 3 agents, amiodarone increases the defibrillation threshold. Okay, that's why you might think about doing DFT testing and things like that. The board is yours. Where do you want to go?
Can we do killing me softly 200?
Okay, so killing me softly for 200, using ambulatory blood pressure monitoring, hypertension is diagnosed when the average 24-hour blood pressure reading is equal or more than. Is it 130/80, 125/75, 110/65, or is it 140/90?
Team 7, Wayne State.
What is 125/75?
Well done, excellent, good job. So that's probably the only time where you have that value, and that came up in the 2017 hypertension guidelines. All right, so the board is yours.
They're killing me softly for 400.
Okay. Renal artery stenosis caused by fibromuscular dysplasia condition affects this portion of the renal artery. Is it the ostium? Is it the proximal 1/3? Is it the distal 2/3? Or is it the perirenal aorta?
Team 4, Ascension Providence.
Distal 2/3.
Well done, excellent. And that's the classical picture where you see sparing of the proximal third and disease in the distal 2/3. All right, so where do you want to go next?
Killing me softly for 600, please.
Okay, killing me softly for 600. An overweight, obese patient with hypertension who loses 10 kilos of weight can expect a systolic blood pressure reduction of, is it 5, 10, 15, or 20?
Team 1, Beaumont, Farmington Hills.
What is 10?
Okay, well done, excellent. So, and for every 1 kilo of weight, you expect 1 millimeter loss of, for every you expect 1 millimeter mercury drop in blood pressure. Excellent. So where do you want to go?
Can we do walk in my shoes for 200, please?
Okay, walk in my shoes for 200. The recommended initial screening test to evaluate for peripheral vascular disease is?
Team 5, Beaumont, Dearborn.
ABI.
Well done. ABI is your first test. Where do you want to go next?
400. Walk in my shoes.
Cilostazol improves claudication, but is contraindicated in this condition.
Team 2, Red, Spectrum Health.
What is congestive heart failure?
Well done. What is heart failure? Okay. So the board is yours. Where do you want to go?
Walk in my shoes for 600, please.
So the left lower extremity ABI in this patient is?
Team 2, Red, Spectrum Health.
What is 0.46?
Well done. There's a number of values here. You take the highest, this is a TBI, and 0.46 is the correct ABI. So which team was that?
2.
Team 2.
Team 2. Okay. All right, team 2, you're doing great. All right, so where do you want to go next?
Walk in my shoes for 800, please.
Okay, walk in my shoes for 800. In patients with PAD, surgical therapy is generally preferred over percutaneous intervention in this vessel. Is it the common iliac, the external iliac, superficial femoral, or is it the common femoral?
Team 8, Beaumont, Royal Oak.
What is common femoral artery?
Well done. And that was team 8, correct?
Correct.
Yeah. And that's a common femoral artery, right? So it's a flexion point. You don't want to put stents there unless you have to. So it's generally femoral endarterectomy is the treatment of first choice. So the board is yours. Where do you want to go?
800.
I don't think we got the points for that, teammate. I don't know.
I thought I did give you the points.
No, we were at 1200 before.
Joe?
Okay. I have the same score, 1700 for team 8.
Okay. All right.
1700.
So we're okay?
Correct.
Okay.
Right?
Yeah. Right, so who answered the last question? Was it team 8?
Correct.
Okay, so team 8, what do you want to do? 600 or 800?
800.
800. Okay. All right. To clear or not to clear for 800. In patients taking rivaroxaban with normal renal function and undergoing low bleeding risk surgery, surgery can be performed after discontinuation of rivaroxaban for at least this number of hours.
Team 1, Beaumont, Farmington Hills.
What is 48 hours?
Unfortunately, that's not the correct answer.
Team 8, Beaumont, Royal Oak.
What is 24 hours?
Yeah, 24 hours. So that's kind of, that's why you gave it. So 24 hours if it's low risk and if it's for rivaroxaban. Okay, to clear or not to clear for 600?
That's Beaumont, Royal Oak.
Yes,
yeah, 600.
So based on the ACCHA 2014 perioperative guidelines, it may be reasonable to forego further exercise testing and proceed to surgery in patients with elevated risk and moderate to good functional capacity. Moderate to good functional capacity is described as the ability to perform this range of METS.
Team 3, Henry Ford.
What is 4 METs?
What is 4 METs?
What is 4 METs?
Okay. So I'm actually going to accept this answer. So the correct answer was 4 to 10, but 4 METs is, I would accept this answer. It's 4 to 10 Mets, but you got the right point. I accept it. Okay, so so I guess that brings us to the final Jeopardy, right?
Yes, before we move forward, I can go over the teams and the scores. Is that right, Kechi?
That is correct. Please do it for the audience. Thank you.
So team 1, Beaumont Farmington, 400 points. Team 2, Spectrum Health, 2,200 points. Team 3, Henry Ford, 1,000 points. Team 4, Providence Ascension, 700 points. Team 5, Beaumont Dearborn, 800 points. Team 6, Ascension St. John, 800 points. Team 7, Wayne State, 1,000 points. Team 8, Beaumont Royal Oak, 2,500 points. Team 9, Ascension Macomb, 1,200 points. Team 10, Michigan State Sparrow, 1,400 points. Team 11, McLaren Macomb, negative 400 points. And Team 12, Ascension Genesis, 900 points. And I got confirmation from Joe that all of the numbers are right.
Okay, so do we go to the final Jeopardy, or do you do the second question for the audience?
No audience question, right, Kechi?
Okay, so now we go on to final Jeopardy. So this has a two-step process.
So can you go over the?
No, actually, I have to go back. Okay.
Yeah.
All right. So each team has to send me their wagers. So they have to give me a number, and that number should go to me. And just use it because I came from 2 accesses. Just send it to the one where you see the video. So you need to give me a number, and then I write it down, and then I put them in, and then you see the question. So far I have team 2. They gave me their wager.
So please change the chat to Dr. Sala.
Okay, so team 1 gave me their wager. Okay, team 7 gave me their wager. And team 3 gave me their wager. Team 6 gave me their wager. Okay, so I'm trying to write it as we go along. So okay, team 5 gave me their wager. Team 12 gave their wager. Team 11 gave their wager. Team 9 gave their wager. Team 8 gave their wager. Team 11.
They're negative scores, so they won't be participating.
I thought negative they can put
Not for Final Jeopardy. Not for Final Jeopardy.
All right. So team 11.
But it's interesting to see that people are putting wagers even without seeing the category for the Final Jeopardy. So they must be very brave.
Yeah. So then, so team 4, can they participate? They can, right?
Yeah, except team 11, everybody else can participate, right, Joe?
Correct.
Okay, team 10. So where's team 10?
Team 10, MSU Sparrow. Have you given?
Did you receive our message now? Team 10. Yeah, team 10 here. We can hear you.
Yeah, I didn't get anything. I didn't get. You should chat. You should send in the chat box, and you should only send it to me so the others don't see it.
Yep.
Yeah.
Unless you sent it.
We sent a direct message to MPD, Dr.
Send it to my to the video chat, because I came in with 2 accesses just to make things confusing. So team 10, I'm still waiting for you.
Okay. Let me find.
Okay, team 10, I
No,
got your. Yeah, I got
you
your.
get it?
Yeah, I got it.
Okay.
All right, so then we go. So then I have to press final here, and then I enter your wagers, right? Okay. So team 1. Okay. Team 2.
Is there a tracing?
We can see the tracing.
Neither can we.
Yeah, the question didn't come up yet. I'm still typing this stuff in.
Are we still expecting a tracing or are we answering?
Just a second. Okay. All right. So a clinical trial presented in the European Society of Cardiology 2020 meeting demonstrated benefit of this cardiac myosin inhibitor in patients with the condition demonstrated by the tracing. So name the drug and the condition. So let me do something. Okay. Okay, can you see it now?
Yeah, we can see it.
Okay, so yeah, so now the next step is you answer in the box.
Privately.
Okay, so I'm starting to see the answers. So Okay, so there's one team that hasn't replied yet, so I assume they don't know the answer.
If it's team 11, they left.
Yeah, no, it's another team.
Okay.
So I think I'm going to say the answer now. So I think I'm going to give them.
Can you tell us which team?
Yeah, team 8. Team 8 doesn't appear to know the answer. So I'm going to give you.
No. We
don't want to wager.
We submitted the answer.
All right.
We submitted.
Yeah, so I don't see it.
Okay, we're typing again.
Yeah, let's make sure everybody has the opportunity.
Did you get our wager though? Because we put our wager too.
We just put it again.
I got your wager. I just don't have your answer.
Okay. Please
Is there a
let
time
us
limit for that?
We put it in the beginning.
Yeah, we're.
How do we message? Should we just message to everyone? I'm not sure. We messaged you directly.
Yeah, that's okay. Yeah, I got all the answers.
You still don't have our answer?
Teammate, do you have
Teammate, yeah. Do you have teammates' answer?
No, why don't you go ahead and give me your answer verbally, because I have all the other answers.
Okay,
It's Meva Campton for Hokum.
Okay, good. Well done. Excellent. All right. So let's go through.
Because of you?
Okay, so then as far as, so this is the correct answer. It's Mavacamten hypertrophic cardiomyopathy in the European guidelines. So team 1, you got that wrong because you did not give a full answer. So unfortunately, we have to deduct points from you. Yeah. Team 2, you got the correct answer. Yeah, it's not updating though. Yeah,
Try pressing it again. Sometimes a little bit slow. Try pressing it again. If it doesn't, then use the adjust score and then just manually correct all the answers. So if you go back to the board, and then if you go to, go to adjust scores.
Yeah, I think that's a better way. So,
Try clicking again.
yeah, that's what I'm doing.
Sometimes it just has to catch. Okay.
I clicked like 5 times now.
Okay. Joe, do you have it up on your screen, Joe?
I do, but I don't have access to the waiters.
Yeah, he can tell you verbally. So if you can go to adjust scores, Joe, and then why don't we switch the screen over to you? So
Yeah,
Joe, take over the control.
Yeah, let's switch it over. And I also have the, the details here. Okay.
Joe, let us know when you take over. Just 1 second, Dr. Abison.
Yeah.
Okay, perfect.
So this is before the start of the changing the scores for the final Jeopardy. So I still have team 1 as 400, and I don't know how much they wagered.
Yeah, so team 1 wagered 350.
And they got it wrong, so down to 50.
Got it wrong, so deducted, yeah.
Okay, next one would be team 4. Oh, sorry. Oh,
Team
I don't have.
That's okay, I got it. So team 2 got the correct answer and they wagered 2,200.
So 4,400.
Yeah.
Catchy, I don't know if I can go down beyond player 8. Doesn't seem to make me adjust.
I see. Okay, let's keep
We'll
going,
get
and then when we get there.
We'll get there.
Okay, now team 3 got the correct answer, and they wagered 1,000 points.
Okay.
Okay, team 4 wagered 700, and they got it right.
Okay.
Team 5 wagered 800, and they got it wrong.
Okay.
Team 6 wagered 800, and they got it wrong. Team 7 wagered 1,000, and they got it right. And team 8 wagered 2,500, and they got it right. Okay, so then we have team 9.
1 second. Okay, so now we're gonna have to do this manually. So go ahead, Joe. We're gonna just do it manually and write it down.
Yep, I'll figure it out.
Yeah, so team 9, they got it wrong, 1,200.
Offline. So
Okay. Let me go to single Jeopardy so that's easier. Go for it. Team 10.
Okay, team 10, 1200, and they got it right.
So up to 2600.
Yeah.
Okay. Team 11 is skipping, and then team 12.
Team 12 wagered 0, and they got it right.
Okay, so this should be the final score.
Yeah. So congratulations, team 8. They are the winners of our Jeopardy competition for today.
Thank you.
So for the audience, team 8 is Beaumont Royal Oak, and so they will be going to ACC 21, and they'll be representing the Michigan chapter in the Nationals Jeopardy. Thank you. Well done, everyone, for playing.
Yeah, everyone got almost all the answers correct. So congratulations, you're top notch, all of you.
Congratulations, everyone.
Thank you so much.
Good game. Congrats, Beaumont.
Good game, guys. Congratulations.
Thanks, everyone.
Congratulations.
Thanks, everyone.
Thank you.
So how did it go, Ketchy?
Good job, Dr. Ebison, Dr. Rao.
Thanks for saving us.
I want to make sure that we sort this out. Okay, I will talk to you later, okay? Okay, thank you. Take care. Bye-bye. Goodbye.